I'm thrilled to be here today with Dr. Carolyn Crooms, a board certified neurologist from Mount Sinai Health System. Dr. Crooms brings a wealth of experience in guiding patients and their care partners through the intricacies of understanding a brain tumor diagnosis. The goal of the My Tumor ID campaign is really to help patients and their loved ones understand their tumor's biomarkers and treatment options, empowering them to make informed decisions about their care. So, Dr. Crooms, the phrase informed decision making comes up so much in brain tumor care, and we know it plays such a crucial role. Could you start off by explaining what that means for somebody who's navigating a brain tumor diagnosis?
Yeah, so I would say as a palliative care physician, and I can explain in a second what that is, since it might not be familiar to everybody. I think of informed decision making as part of this broader spectrum of serious illness conversations, where we're really trying to understand, what is important to somebody, make sure they have all the information they want, they need that's available, and that allows us to make decisions together. Informed decision making is maybe something that we're doing that's around a specific decision. So making sure that someone has the available information about the significance of the decision to be made, the potential outcomes, benefits and potential drawbacks. So being able to really have all the information that you want to be able to make that decision. And again, that I think is part of this bigger spectrum of trying to make sure that we're treating an individual person and their family and their needs, as well as, since we're talking about biomarkers, an individual tumor that may not be the same as another person's.
That is such an important point, and thank you so much, Dr. Crooms, for sort of explaining what informed decision making means as a whole. I do want to touch upon you saying that explaining now what neuropalliative care means for us.
Yeah, exactly. So I'm a neurologist, and then I also did a fellowship in palliative medicine, which is a specialty focused on improving and optimizing quality of life for people living with a serious illness. That means things like symptom management, kind of coping with day-to-day changes as a part of a serious illness, and in some cases, planning ahead for the future or navigating complicated medical decisions, often from a slightly different perspective than we might do informed decision making as as any clinician. And ultimately, palliative care is really an extra layer of support for people with a serious illness, sort of along with their neuro-oncologists and the other specialists involved in their care.
Wonderful, thank you. And if somebody's struggling to make these important decisions, how do you help them through this process together? Are there steps that you help them take, or would love to hear how you help somebody through making these some of these important decisions?
Yeah, absolutely. I mean, I think, one of the first things that's so important is figuring out what somebody already has been told. So just starting out by asking someone what they know, what the other doctors have shared. There are so many different specialists involved in treating a brain tumor, surgeons, oncologists, radiation oncologists in a lot of cases, among others. And sometimes it's not clear who's sharing what information, and we're meeting people at different times. And also, different patients and family members have different preferences for how much they hear. For some people, it might just be, I have a brain tumor, that's plenty. And for others, they might like to know really all the ins and outs. So that would sort of be a first thing that I would say is kind of asking what somebody has already been told, maybe what they've read on the internet, because that can also come up. And then the next thing is to make sure that we're sharing information that is very clear and jargon free, which can be hard, I think, for physicians and other medical professionals to do since we spend so much time steeped in the language of medicine. And it's totally fine for patients and family members to say, I didn't quite understand that. Can you explain what it meant? And then the other thing that I think is so important is asking people what's most important to them. Because again, we're couching all of this decision making in the context of somebody's life that they're living, the things and activities that they value, how they want to be spending their time. And then another thing that I think sometimes can be overlooked is thinking ahead to the next step, right? So sometimes, for example, if we're talking about surgery, when someone is first diagnosed, we say, okay, here's the surgical plan. We can talk through, the benefits of doing the surgery and any potential risks that might be involved. And what happens after the operation is complete is something that, people are often overwhelmed and may not think to ask that question. But unfortunately, a lot of the time we end up sort of playing catch up in the, information sharing, I think. And so having that extra step of, this is what it means, not just today or tomorrow, but in, the next weeks and maybe months.
Think that's great, and that's really helpful advice. We very much encourage patients and their families, to ask their doctor questions. So if you feel like you are not getting the answer that you need, we want to encourage them to continue to ask questions until they do understand, right, maybe a treatment option or a path forward, so that they can make an informed decision moving forward. I'd
Absolutely.
love.
And sorry to interrupt. One other thing I would say there is that I think it's also okay to recognize that it is often multiple conversations, right? Especially when you're new to a diagnosis, there's so much to absorb, and you may not think of a question in that given moment. And clinicians expect to be asked questions, at a later date, or to kind of say, hey, I need to revisit that. So that's okay too.
That's wonderful to hear. So, from your perspective, what are some practical tips that you would give somebody, whether it's a patient or a caregiver? What are, yeah, what are some ideas that you can share?
Yeah, I think that really taking notes is a big one, because again, it's often a wealth of information and you sort of need to go home and digest. Maybe you're going to see another physician who will answer those questions. And so being able to kind of carry information from place to place would be one. I also really encourage people to bring at least one other person, a family member, a friend, a caregiver, to visits, because a lot of the time it's, just really too much for one person to absorb. And I think it's important to kind of have that support. And then the other thing I would say, kind of on that same note, is that I really encourage everybody, regardless of a brain tumor diagnosis or anything else, to have someone who could be a healthcare proxy, right? A surrogate decision maker in the event of an emergency, who's familiar with the medical context and the personal context to be able to say, this is what Jenna would want, in this situation. And so I think having someone who's really involved from the get-go can be really helpful in that regard. And I do sometimes help people come up with questions for other physicians or healthcare professionals involved in their care, because again, you can't know everything to ask necessarily.
That is excellent. All right, Dr. Kroom. So, if somebody is really feeling stuck in making a decision about how to move forward, what are some questions that you can provide them to be able to make that informed decision?
Yeah. I think it depends so much on an individual person's circumstance. But I do think that asking about what would the next, you know, weeks or months look like if I choose to pursue this, maybe kind of anchoring it to specific worries or hopes that a person has. So again, just using the example of independence, or you know functional ability, I think asking about how will this affect my, my speech, my fatigue, my ability to work, something like that. For some people, really thinking about life expectancy. Is this something that we expect to extend my life? And if so, by roughly how much, recognizing that there's a lot of uncertainty there. Um, or other things that you might be, worried about, side effects, that type of thing. Um, and I think, there's such it's so complicated to think about getting information from other resources, but I think that really the community of people who have brain tumors or whose loved ones have brain tumors, there's so much to be learned from other people's experiences, and I think having those conversations and then bringing them back to your medical team can be really helpful. But yeah, just trying to think about what are the different options on the table and how do they affect the things that really matter the most to me in my life.
Thank you. Right. So it's not only just understanding your tumor's biomarkers and your treatment options, but everything else like side effects and benefits and risks and your goals of care, right? And just the impact it could have on your quality of life or just, your daily living. So thank you. I think that that's very helpful.
Yeah, and I also think that it's important to remember that you can change your mind, right? You're always driving the ship and you can say, I want to try it and see how it goes. And then you could say, you know what, this isn't really working for me and I don't want to do this treatment anymore. And so you're not really locked into one thing or another for the most part.
Oh, that's so great. Dr. Crooms, thank you so much for sharing your insights with us today. Informed decision making is about having the knowledge, support, and confidence to make choices that align with your personal goals and values. We're very appreciative of your time and expertise. So thank you so much, Dr. Crooms.
Thank you so much for having me. It's been a pleasure.
You can learn more about making informed decisions at mytumorid.org.